Coming up next on Being Well, we'll have a discussion about hospice care with Lisa Karalevich of Lincoln Land Hospice. We'll learn more about what's involved in hospice care, from the types of services provided to where it takes place and for how long. Lisa will also address questions that you may have about hospice care and if it's the right choice for you or a loved one. That's coming up next on this edition of Being Well. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thank you for joining us for this edition of Being Well. I'm your host, Lori Casey, and today I'm joined by Lisa Karalevich from Lincoln Land Hospice. Thank you so much for stopping by the show today.
Thank you for having me.
Well, our topic of discussion is hospice care, and the first question that probably a lot of people have is really, what is it?
Hospice is actually a service that is provided for people who have a terminal diagnosis and a limited life expectancy. It's a focus on quality of life versus quantity of life, and really when someone chooses to take a comfort care measure to their health instead of a curative measure.
So is hospice care is it for people who are dying?
It's for people who have limited life expectancy, and you know, we all have a limited life expectancy. Right. None of us are going to live forever, but it's for people who have 6 months or less life expectancy. And you know, anytime your physician has talked to you or a loved one about, you know, that months instead of years. So you know, that is the time to look into hospice, when they start having those conversations with you.
So in your area of work, what do you think is the biggest misconception out there about hospice care that people are just not aware of?
You know, I think, you know, one of the things that we hear is that I wish we would have known about hospice sooner. So it's, you know, I truly believe it's about taking control of your health and, you know, having those conversations with your physician and, you know, asking, you know, what do you think for the next year in my life? You know, what's am I to expect for as my healthcare needs come up? And, you know, it's sooner than later, and let's have a plan for that.
And it's a hard thing probably for families, loved ones to even think about. So how does it even come up in conversation, or how does the thought of hospice care usually present itself as an option?
A lot of times it's, you know, when patients are in the physician office, or, you know, more so when they're in the hospital and they've had multiple trips to the hospital, you know, the physician will start talking to the patient about hospice and, you know, talking about, you know, what is our next plan of care for you, and really starting to go with that.
So really it's probably, or should maybe be, part of the overall care plan for somebody.
Absolutely. And, you know, like I said, you know, take control of that, and, you know, start talking to your physician about that. You know, don't always wait for the physician to bring that up. If you are seeing a decline in your health and seeing a decline in your loved one's health, you know, start talking about that and having a plan of care. So
do you think that choosing hospice care means giving up on
Absolutely not. I think it's about taking control of your life. And, you know, we hear patients talk about all the time of, you know, I'm tired of being in and out of the hospital. I'm tired of having x-rays done. I'm tired of going for chemo when there may not be a positive outcome. So it's about quality of life. You know, we once had a patient tell us that, you know, why do I want to be in and out of the hospital? Why wouldn't I rather spend extra time with my family and enjoy them for the few months I have left?
So where does hospice care actually take place?
Hospice care can take place in anywhere that a person calls their home. We are in the residence home, we're in nursing home, long-term care, and we're in assisted livings. So anywhere that you call home, we're able to be.
Now, does it have to be something that your primary care doctor has to suggest or offer, or is it something that anybody can, if they're in that situation or they have a loved one in that situation, that they can pursue?
You can wait for your physician to bring it up, but also you can go and seek information. Call a hospice organization, call Lincoln Land Hospice, and ask them questions. It's all about knowledge is power, and having that knowledge so you know when the right time for you is to start hospice.
So what kind of services does hospice provide? It's not probably like Make-A-Wish, where you get to, go to Disney World. But what are some of the things that a hospice service provides?
Some of the things that fall under the hospice benefit is you have a registered nurse that comes to your home, and they really take care of the symptom control. Other people that would be visiting your home are certified nurses aide and social workers, and we have volunteers that can come into your home, and that's such a great relief for a spouse or caregiver, our volunteers, that they're able to leave the house and get out and run errands and go have their hair done, but know that there's somebody sitting with their loved one. We have chaplains that respect every religion and are really there just to hold hands and to give that spirituality and talk to them. Once the patient has passed, we have a 13-month bereavement counselor that will be able to help with the family members for 13 months after the patient has passed. Some of the other things that are included in the hospice benefit is, durable medical equipment, hospital beds, oxygen, wheelchair walkers, anything that they may need in their end of life, we're able to have that for them. And that's all covered under the hospice benefit and is billed under the hospice benefit.
Okay.
Pain medication, any kind of medication that is needed for that specific diagnosis is also covered.
So it goes way beyond just medical care and someone administering medications or doing wound care or anything like that. There's other aspects as well.
Absolutely. That's, part of the social workers' responsibility, and they go in and have a lot of those tough conversations of, let's plan for the end. Let's make funeral arrangements. Do we have a healthcare power of attorney in place? And really getting the family and the patient on board with what is going on in their health care.
Yeah,
and what the expectations are.
Because there are a lot of decisions to be made, and we've done a couple of programs on dealing with death, and there's so many things that come up that you don't even think about that need to be taken care of once a person passes away. I would imagine through hospice care you can have those conversations and get some of those details taken care of while the person is still alive.
Absolutely, and it's better to be prepared for that. Otherwise, you're making rushed decisions, and it's an overwhelming process. It is. I mean, even when you do prepare for it, it's still overwhelming, but hopefully it's a little less overwhelming. Studies have shown that people who have been on hospice for 2 or 3 months, their family copes better afterwards. They're better prepared for that. Everything is still difficult, but it's just an easier process for them.
So is there a time limit for hospice care? Can you only start it if you're given 6 months to live? Can you only start it at 3 months or 2 weeks?
Absolutely not. We actually talk to your physician and have them, if they say that, yes, to the best of their knowledge, I believe that this patient only has 6 months or less of life expectancy. That's, what we really look for, and a terminal diagnosis. And once we have that, we can start somebody on hospice care. Now, say they live beyond that 6 months, that's okay. One of the things, as long as they're showing decline, and we have people that graduate from hospice care that they come on the hospice and they all of a sudden get better.
Have a rebound.
Absolutely.
their cancer goes into remission or something.
And that makes us so happy when that happens. I mean, you know, a lot of times their cancer doesn't necessarily go in remission, but they just start feeling better and they do rebound. But you know, once they start to make that decline again, we're able to bring them back on to hospice.
As we're talking about cancer, is hospice only limited to people with certain types of diseases, say cancer, or is it open to anybody?
It's open to anybody with that terminal diagnosis. Cancer, we do have a lot of cancer patients. We also have a lot of cardiac patients and people with respiratory issues such as COPD or emphysema, stroke patients, Alzheimer's, and Lou Gehrig's disease.
I would think in Alzheimer's is a long-term illness and can take several years to progress, but I would think Alzheimer's, the dementia forms are quite common.
I think it's becoming more common, you know, as you know, they're doing more research with Alzheimer's. We're better able to identify when that end stage for Alzheimer's patients really is. So I really think that is becoming much, much more common.
So when I think of not knowing a lot about hospice care, I would maybe assume that it's for the elderly. Is there an age limit?
Absolutely not. We take care of patients from 0 to 100 plus. Not every agency is pediatric trained, but we have taken care of pediatric patients. So no, there is no age limit with hospice.
So are there differences in the care if you're caring for a child? Do you do more of, maybe if they're able to, maybe more of those kind of Make-A-Wish sort of things, or is the care is it any different than if the person is elderly?
Not really. We give everybody the same care. We do have a Grant-A-Wish foundation that we offer to all of our patients. And, you know, it's just really neat to be able to grant one last thing to a patient or a family. A lot of things. One of my favorite things that we do is life celebrations, where we just, you know, celebrate their life and have a party and invite, you know, their family and friends in to enjoy just some extra special time. We've rented limos and taken them out to eat and taken them to a play, you know, with their close families. So we've done all sorts of things. We've had Harley rides and done pool parties, and it's just really neat, you know, that we're able to do that for the patient and their families.
So let's talk about the cost of hospice care. We'll get a little more into the specific area that Lincoln Land serves, but in general, so if people are watching this program, they're not in an area served by Lincoln Land. In general, who pays for the cost of hospice care? Or
hospice is covered by Medicare, Medicaid, and private health insurance.
Okay.
As long as you meet the requirements to be on hospice. And that's all stuff we research and look at prior to having anybody admitted to hospice.
Okay, so let's talk about Lincoln Land. You serve a large area here in East Central Illinois.
We do. We cover 20 counties around the Coles County area.
So in other areas, is hospice part affiliated with a hospital, or are they usually a separate entity from a hospital?
It can be both. There are, you know, hospices that are owned by hospitals, and there's national hospices out there.
Okay, so if someone is seeing this, whether on broadcast TV, on WEIU, or watching us online, and maybe they're in another part of the country, or their loved one is in another part of the country, what should someone be looking for when they're looking for a hospice program?
Well, they want to call the hospice. You know, we do informational visits with our families, which actually gives the families a chance to meet the nurse or the social worker that may be taking care of them. So that's a great one-on-one time to make sure they offer all the services that there is. Like I said, the registered nurse, which they all offer that, and the CNAs, and, you know, the chaplains and the volunteers. Volunteers is a huge part of the hospice, and that is something that gives just the caregivers some time away and the reassurance that their loved one will have someone there. Even they're sitting in another room, they're not left alone.
So make sure that they have proper credentials that they're...
Absolutely.
Is there a certification process or something? I mean, I know you would want to look for someone that's an RN, certified nursing assistant, those kind of professionals, but is there anything else we should be looking for?
Well, the hospice program itself should be credentialed.
Okay.
So, those are, like I said, those are good questions to ask. And, the best advice I can give is to call your local hospice agency and just ask questions and, get that, informational visit. And, everybody should do informational visits and you get to meet them and, get one-on-one time with them prior to signing on to hospice.
So what advice would you have? Maybe there's a family out there and maybe it's dad that is, terminally ill, and maybe the children want the hospice care, but maybe the patient is reluctant to do that. Does that ever come up where maybe the family wants it, but the patient doesn't?
Yes, and we also have vice versa where, the patient, we actually see it a little more where the patient is ready. They're ready to select hospice and go towards comfort care instead of a curative measure. And the children aren't ready for that step in life. So, it's all about that open line of communication, invite everybody in and sit around the kitchen table, have a nice little dinner and, start to open up the line of communication and make that plan. A lot of times our patients are ready to be done with the in and out of the hospital and being admitted to the hospital every couple months and all the testing that's involved with that. And they're just ready to be at home and, be comfortable.
So if someone is at home and they're in hospice care and maybe they take a turn for the worse, who actually in the hospice care team decides, what, the level of care you need, we can't do that in the home and you need to go back to a hospital?
It would be the registered nurse would be who the patient and the family would be talking to, but our registered nurses work closely with their family physician and, really creating that plan of care. They're in contact with them a lot in, discussing what is going on with, the patient today and, every time there's a visit, the physician gets a report on what's going on with that patient.
So does that happen quite commonly where maybe the patient started hospice care in their home and then they do have to go back to the hospital?
It does happen. It doesn't happen a lot. A lot of times when that does happen, it's, we're not able to get some symptoms under control within the home. When they do go into the hospital, they're still considered under the hospice benefit and, the same nurse and their family physician can see them.
That whole care team can kind of come along with them.
Absolutely. We don't discharge them once they go back into the hospital. It's an inpatient hospice stay within the hospital, and then we continue to take care of them.
So at most hospitals, is it, if you're readmitted to the hospital, are you just in the regular hospital? Or at Sarah Bush, is there a hospice area or hospice wing, or is it just part of the general hospital patient rooms?
It's in the same area. There are a couple rooms that are dedicated if we do have a patient that is on hospice in the hospital, but it's all part of the same area. And you have access to the nurses on the floor along with the hospice nurse and your family physician.
Can you talk about, you've mentioned it a couple of times about how hospice care really eases the burden of the caregiver. I would imagine that that's a difficult position to be in, providing care and dealing with the emotional and physical strain that a terminally ill loved one can have. Can you address how that can really take the burden off the caregiver by having hospice care?
It's the additional support that they receive, as they, our nurses come in and see the family members and see the patient. They're also placing focus on the family and addressing any questions or concerns that they may have and really helping them through this process. You can receive visits 1 time a week or 7 days a week from a nurse. And, along with that nurse, you can receive that visit from the CNA and social worker as well. We really do not limit how many times we are seeing our patients. And, you know, we want them to be comfortable and have that support that they need. A lot of times it's reassuring that, yes, you are doing the right thing, and, you know, what, you know, your husband or wife is going through is, it is normal. It's just reassuring for the family member.
Well, that's what I was going to ask. How do you determine, like, how many days a week you come, for how long? How is that all figured out?
You know, for each and every patient, it is different. You know, it depends on when we get them within their disease process. You know, if we get them early on and they're still going out and about, we may only need to be in there once a week or once every week. And, you know, on our off weeks, we just do a follow-up phone call to them. So it really depends on where they are in their disease process.
So it may not be you're going to have someone in your home every day for 4 hours a day.
Absolutely not. Typically, if we're in their home, it's for an hour, maybe an hour and a half, 2 hours. And it can be more. Just like I said, it really depends what's going on within the home and what kind of symptoms the patient's having. But no, you know, once a week to 7 days a week.
When we started the show, you had said you've had a lot of people say, I wish we would have started it sooner. What is the reasoning behind that, do you think?
Well, I think there's a large misconception of hospice, and that it's only needed in the last couple days of life. And, you know, it's if you know, are proactive in your health and what is going on in your healthcare needs, and have those conversations with your physician, to have it 2 to 3 months prior, you know, it's just that extra added support to the loved one, to the family members, and to the patient. People really try to, you know, handle things on their own, and usually, a lot of times when we get called in, you know, we're getting called in at the very last couple days to a week.
So if you can, and you have the forethought, think about calling someone and getting the process started early on, if possible.
Absolutely. You know, and even if you're not ready for hospice at this time, you know, have that information. That way you're able to make that decision when the right time for you. Just because the right time for somebody is 2 days ahead of time doesn't mean that's the right time for you. There is no process that is the same. Each and every patient, you know, what we do for them is different. It's all the same in the care that they received, but it varies because everybody's disease process is different, and nobody follows the same way.
Well, Lisa, we're all out of time. I want to thank you so much for coming by Being Well today and talking to us about hospice care. I think it's probably cleared up a few questions that people have had, and if you're ever in that position, that it's something that people would consider.
Absolutely. Thank you for having me.
Thanks.
The results are in from the best diet rankings from U.S. News and World Report. The popular DASH diet eating plan was ranked #1 for the 4th year in a row. Second up, Therapeutic Lifestyle Changes diet. Tying for 3rd place spot were the Mayo Clinic diet, the Mediterranean diet, and Weight Watchers. Last on the list, the controversial Paleo diet, despite being the most searched on Google last year. The rankings are based on safety, effective weight loss, heart health, and diabetes prevention. You have asthma. That's what many people diagnosed with a condition called subglottic stenosis hear from their doctors. They may get misdiagnosed because it's very rare and it causes your airway to narrow until you're breathing through a very tiny opening. Doctors at Mayo Clinic have developed new ways to treat this issue that otherwise leaves people gasping for air.
I was breathing through 5mm opening.
Imagine that, breathing through an opening the size of a cocktail straw. That was reality for Jill Pottinger-Moe, who has subglottic stenosis, a condition that happens almost exclusively to women.
It was a real labored breathing compared to people called me Darth Vader because it was
Just walking through this store would have made Jill profoundly short of breath.
Once I bent over and went to pick this up, I would be wheezing and gasping for air, and there's no way I would be able to talk at the same time.
Idiopathic subglottic stenosis. We use the word idiopathic because we don't know the cause. Subglottic stenosis in of itself is a scarring of the main windpipe right below the vocal cords.
Dr. Eric Edel and his colleagues at Mayo Clinic have studied this disease and developed a standardized treatment that helps keep the airway open. Here's how. Due to the progressive scarring, the windpipe slowly narrows, severely restricting airflow. During an endoscopic surgery, doctors make 3 small incisions into the scar tissue. This opens the airway and restores breathing. And because the issue will likely recur, patients like Jill are on medication afterwards to treat potential causes of the scarring and inflammation.
So we put everybody on aggressive anti-reflux measures,
plus inhaled steroids and an antibiotic. And if her airway does start to restrict again, Jill can have the surgery again as many times as she needs it.
It's just so amazing to be able to breathe.
After 7 years of struggling for air, Jill says she's loving life and breathing easy.
And now it's just wonderful. I can breathe, I can talk, I can walk, I can exercise. It's changed my life.
For Mayo Clinic News Network, I'm Vivian Williams.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.